the erosion of workers' rights in the face of healthcare manipulation and state immunity. In an impassioned communication, Darren Fonzseau, a dedicated advocate for injured workers' rights, has brought to light a critical issue affecting America's labor force, specifically the manipulation of healthcare to undermine socialized benefits such as SSDI, state and federal workers' compensation, veterans' benefits, and private care. This issue strikes at the heart of what Fonzseau terms a class war on America's workers. The root of the problem lies in how catastrophic and non-catastrophic on-the-job injuries, OJIs, are treated differently, creating a disparity that benefits employers at the expense of employees. The system maintains sufficient protection for employers against claims from catastrophic injuries, while systematically eroding benefits for non-catastrophic injuries. This forces many workers to rely on federal benefits such as SSDI, which can be difficult to secure due to systemic denials fueled by cost containment strategies. Fonzseau's allegations suggest that this systemic erosion is facilitated by healthcare professionals who, protected by state immunity, allegedly falsify or manipulate medical evaluations to deny claims, thus containing costs for employers and the state. This practice not only places an undue burden on aging workers, who are often denied rightful claims as they surpass 50, but also pushes them into destitution as they struggle against these wrongful denials. Moreover, Fonzseau highlights a concerning aspect of vocational services, which are purportedly more focused on finding reasons to deny claims, rather than providing genuine retraining opportunities that could help injured workers reintegrate into the workforce. The Washington State Attorney General and state lawmakers, according to Fonzseau, are complicit in this system that shifts the state's financial burdens onto federal programs, thereby avoiding their responsibilities under what was once considered a grand bargain between workers and employers. This grand bargain, designed to ensure fair treatment for labor in exchange for their contributions to the economy, is now perceived as being hollowed out to serve the interests of a cost containment industry that profits from the denial of benefits to workers. Fonzseau's call to action is a desperate plea to acknowledge and address the ongoing class war, a conflict where the working class suffers under the weight of a healthcare system manipulated by the elite to preserve their economic interests. This scenario paints a stark picture of a divided society where state-supported professionals potentially exploit their positions for cost-saving rather than caregiving, leading to a broader societal and moral crisis. The implications of these accusations are profound, urging immediate and thorough investigation and reforms to protect the rights and livelihoods of America's workers, ensuring that the healthcare system serves its true purpose as a support and not a barrier to fair worker compensation. It's been 8 years of silence since workers were told we need these basic federal human rights for all of America's workers. The system is still broken. While no one is representing America's workers, not even our unions, see how injured workers are dying playing the delay and denial games in SSDI and our VAs. It's ageism, as the state tries to cost shift their burdens under the labor's grand bargain off to the feds. It costs more to try and cheat injured workers than if folks just help us out the HMO doctor's gates to stay.